Hi, and welcome to How Vision Processing Deficits Influence Patients' Behavior. My name is Doug Major. I'll be showing some experiences of the patients that we've had, as well as a professional, and how excited I am about this opportunity we have to serve this population. You know, traditionally, 150 years ago, the use of eyeglasses was simply to achieve the 20/20 eyesight. We're suggesting that's outdated. There's some breakthrough with neurology and presents opportunity for prescription glasses to selectively be designed to alter the sensory integration of our systems. These alterations can positively affect learning disabilities, autism, concussion, and many other acquired brain injuries. You have to remember the retina serves as a two-way portal, meaning there's a feed forward and a feedback way for light to disperse on the retina that impacts directly brain function in various systems, altering biomechanics, biochemistry. You know, currently eye exams are primarily focused just on the slower central passage, the 20/20 passage. New research reveals that activating light contribute three concurrent levels of processing: the analytical, the conscious, the intuitive, the subconscious, and the autonomic, the unconscious. Among the eye's 126 million light-sensitive receptors, there's rods and cones, specialized ganglion cells, and these chemical pathways have a feed-forward and a feedback system that customized lenses can exploit. Light to aid neuromodulation and rehabilitation, whether it's acquired or traumatic, requires a different clinical strategy than is used by clinical doctors for just best clarity, the conscious central macular system. Prescribing for the brain injury requires measurement of unconscious retinocollicular pathways, the non-image forming pathways they discovered really just recently, and the subconscious awareness from those peripheral eyesights. One of the ways that you can work with that is a test called the Z-Bell test, which is an exciting new addition to the neurooptometric toolbox. It's interesting, the input to the system, we've got air, food, water, just goes through our systems to drive the energy requirements and rebuilding and building of our bodies. People forget, though, light is that big input that goes through our eyes and actually elsewhere. And that helps us drive the what is it, where am I, and how am I systems through interesting connections with different areas of the magno, parvo, and conio systems. And all these systems drive different areas of function. Interestingly, using glasses, we can expand space or constrict space. This balance between where we are in space, we can use glasses to stimulate those systems via expansion or constriction, dilation. And that makes these glasses a very powerful therapeutic tool. So the first that we hear most about is, fixing for near and farsightedness, just regular spherical lenses that bend light towards the retina, alters the balance, but we can use that to alter the balance between central and peripheral pathways. Spherical lens, minus lens for nearsightedness, plus lens can disperse light more symmetrically. And of interesting note, cylindrical lenses actually can put a sector and move the light towards different areas. So we have all these different ways of dispersing light. Here at the Brain Conference, Kanisa, who gave a wonderful concert at the gala, we had a chance to talk to her afterward, and she talked about how she felt like her contacts were way too strong, making her too focused. And can't we unfocus it? It's so fascinating that people, even after a brain injury, can intuit that there's something wrong and there's something that needs to be fixed. And so that's hopefully something we can do to help her. Another interesting tool is anisometropy. A lot of times we might want to make each eye, the prescription, each eye focus for that eye, but when we start thinking about this contraction, sometimes we have to alter that power and use that therapeutically to make both eyes function maybe a little bit differently to change brain inputs. So for therapeutic reasons, there's very interesting things we can do. Filters and sector occlusion also alters the input and thus selectively can suppress or stimulate the sector nature of our retinotopic MAC. That's the map inside our eyes. Binasal occlusion is very common after brain injury, actually stimulates the hypothalamus and actually reduces the load on the focal binocular system. That can be, it's fascinating how that's been shown with different, how the retina is divided into different functional sections with the distinct proteins in each quadrant. So we think of the retina as just a homogeneous piece of tissue. It's not. Every sector is different, programmed for different things. And as we saw with Dr. McKinney, the wonderful pediatrician that was in Africa that got meningitis, she is strongly affected by small changes in input. And we think about this as we think of lower animals. The mouse has a part that's programmed for looming, to freeze or flight, as well as looking down to find something moving to eat. So it's, we know these systems are there. We just haven't applied them to the human. Yolk prisms are unique. They angle light towards one edge of the retina and actually reflectively cause changes in our posture. It makes the internal posture mechanism, the hips and the stability mechanisms change. This important balance between vestibular and eyes can be altered there because of these prisms. Also location, base up prism goes more to the parietal, base down more towards the temporal, and it causes different leanings and different resets. Left prisms go more to the left hemisphere, constricting space, the right, just the opposite. A powerful tool that we use almost every day to help individuals be recentered and recalibrated. So here's an interesting view of somebody showing and demonstrating what yolk prisms have. So I'm demonstrating looking at a spot with my eyes open, then my eyes closed, and with my eyes continue to be closed, I sort of recalibrate, and you'll notice how I no longer point to the right spot. Even with my eyes closed, now opening my eyes with my conscious system, I direct. So this is a demonstration that we do have access to the subconscious system and how that changes that pathway. For non-yolk prisms, they're the ones used for people that have double vision. We can angle light either towards the nasal or retinal the sensors, and a lot of individuals will use that to help also pull our attention to different objects or stimulate nasal fibers versus temporal fibers, and also cure or at least temporarily help double vision. Filters with specific wavelengths, we've known for years, organizes different areas of the retina. Of course, we have the different pathways for the different wavelengths, the shorter wavelengths, the blue that has that higher energy, the longer wavelengths, red light now is very popular. And these change not only the color perception, but actually moves our visual space and helps individuals like with headaches and other things. That can be done not just for a try it and see approach, but actually therapeutically. So we have all these tools: lenses, filters, prisms, physical mental games or vision therapy, and prescribing eyeglasses that can integrate central and peripheral pathways can be very powerful. And these interventions can be used in many forms, in solo, in combinations. And for example, many cases, a plus lens with a bidirectional yolk prism are used for effective therapy glasses. And we can combine that with specific stimulation with vision therapy to improve vision, accommodation, and ocular motor functioning. So understanding and gaining access to this non-image forming pathway is key to access the brain function in many these disorders. And traditional prescriptions only do the conscious central passageway that measures the 20/20. Prescribing for patients with brain injuries, and particularly like in this autistic spectrum, requires measurement of both the unconscious and the non-image forming pathways, particularly those who are not communicative. So we have to have a technique to use it. And sometimes those best choices may not be achieved by that external environment and for that balance. So the advantage of a test like the Z-Health is a new measurement tool that helps us to improve the quality of life through connecting through that subcortical pathway. Hey, we all know if you get a wrong set of glasses or drunk glasses, they can cause headaches immediately, sometimes long-lasting, blurry vision, dizziness, vertigo, disequilibrium, fog, maybe even throwing up, double vision, brain fog, photosensitivity, and this bloating, anxious feeler because you don't know where you are in space. And so if a wrong prescription can cause all the symptoms of acquired brain injury, what about reverse engineering that and use this powerful input system to treat or reset a damaged system? And our answer, could that happen? A definite yes. So there is a very specific analog that's for algorithm for prescribing just spectacle lenses for that central vision. That's if you go to the eye doctor, which is better, one or two? I do it all day. Dial down to 20/20 next. But rehabilitating these peripheral ambient systems requires non-traditional spectacles. And again, this new technique with the Z-Bell and others, we can detect those orientations subconsciously and access that center before not only prescribing, but we can verify, that's the main thing, verify the efficiency of those new lenses using spatial touch. Now, interesting enough, of course, we verify the 20/20 by being able to see that bottom line. This is be able to verify that you're able to visualize and or subconsciously identify where things are in space with your eyes closed with the Z-Health technique. Let's highlight a few interesting cases that we do, and we do these cases all the time. We had a hard time choosing, but these were interesting. Julia, TBI at age 12, right during that puberty time, first visit at 15. She's sort of a mess, unable to accommodate, poor anxiety, depression, self-harm, smoking, drugs, excessive makeup, unwashed hair, hurts to think. We go ahead and get the special lenses, do some traditional vision work to help her get used to those. Headaches improve, posture improves. And at first time she got the glasses, she danced around the room with her new glasses saying, I've got the magic, I've got the magic. It was just dramatic how she just realized all of a sudden, this is the way my system is supposed to work. Since that time, she progressed, to the point of no headaches, everything improved. Quit her smoking, eventually, cleaned up and took the high school proficiency. She's now just graduated from college, very clean, sober, working very well. It's just wonderful to be able to help people in this way at that key time in their lives. Another individual, Judy, a little older, wonderful math teacher, very smart person, teaching school at Morro Bay High, has a diesel engine next to her for construction for 3 weeks. Something happens. She's different. We suggest carbon monoxide poisoning, blurry vision, can't do two things at once, disoriented. Her husband's frantic. Where is my wife? She gets her first pair of non-traditional therapeutic glasses, and for 10 minutes we're talking, and all of a sudden we realize she used to have, be in her own bubble. She starts making comments. Her husband, what? She said, ooh, I feel so free. I feel like I've had a couple glasses of wine. And said she hadn't really put two words together very well since that time. So as she continued to use that therapy and do other therapies, eyes open wide, she started really being lively. Judy came back. She could stand up and look around. Her gaze got better, less headaches, dizziness, laughing. We continued to alter the glasses to continue to drive that neuroplasticity. She's up to her fourth set now. Very successful with language therapy. Just a wonderful story and a wonderful person. It's great to help these people. Now, this case, I thought it'd be good if we actually quoted his own words. Mark, he's 72 years old. Concussion I suffered in January 2019 as a result of a minor accident. All the classic symptoms, dizziness, fuzzy thinking. Driving required all my attention, even for a short run to the grocery store. Saw a number of physicians, had the CTANs, diagnosis of concussion, but no treatment available, just rest and no alcohol. After 5 or 6 months, I started getting depressed because this is my new normal. And so here's some of his tests. We went ahead and did it's called a right eye that showed a low score, particularly in vertical going up and down with his one eye. He actually had a specialized type of glasses with some prisms altered to one direction, in this case to his right. And then he talks about, he said, I was reading a paper I saw about an optometrist locally who treated his concussion with Dr. Zielinski's approach. And he wrote this prescription for me. The day I picked it up, my new glasses was the day I had an unusual moderate degree of symptoms, felt lousy. You're going to wear the new glasses that day, and by later afternoon, virtually all the concussion symptoms were gone. This is a full 7 months after my injury. He's doing really well. He still wears that specific type of glasses. We've adjusted a little bit. But he said he's one complaint after I called him a few months later. I can only drink one glass of wine now, 2 glasses of ethanol, and the symptoms come back. So I said, Mark, just one, I guess. Is this shown in other stronger neurology? Absolutely. Corey did this wonderful connection where he showed an individual with the resting state, eyes closed, wearing the glasses. So their eyes are closed, resting state, wearing the glasses. And this is with the eyes closed, taking the glasses off. So again, while the eyes closed, the glasses made this big change. Both sets eyes closed, so the therapeutic glasses can change function underneath the eyelids. And then this is the same thing, baseline without glasses and then with glasses. Again, showing that there's definitely a brain change. It's just how to harness it and do it well. Of course, our person that made all the difference for me to pursue this is Clark Elliott. And just be aware how gratifying it is as an eye care professional to be able to help these individuals, to positively impact these impairments that we couldn't fix before. And we need to use this tool to go ahead and use it just as it worked with Clark and the ghost in my brain. And what a powerful way, and it brightens my day every day to be able to help people in this unique way. I encourage other eye care professionals to pursue this. So in conclusion, repurposing existing accessible optical technology to alter brain function is an effective and cutting-edge is supported by neurological research. Just as misprescribed glasses and prisms and filters can mimic a brain injury, reverse engineering these elements, when properly selected, can also be used to drive neuroplasticity, recover function lost by an acquired brain injury. Not only symptoms, but actually cognition. Absolutely amazing. I'm amazed each day the ability to do this. Thank you so much for your attention. I'm going to go ahead and just scroll through some references that you can maybe fix screen if you want to look further. Fascinating support is the application that I'm so excited about. Anyway, best wishes and wishing the best for you.